What is an oncogene in breast cancer treatment? Imagine a tiny switch inside your cells that controls how they grow and divide. In healthy cells, this switch is carefully regulated. But in cancer, sometimes this switch gets stuck in the on position. That's what an oncogene is. It is a mutated or abnormally activated gene that causes cells to grow uncontrollably. In breast cancer, oncogenes play a big role in how the disease develops and progresses. Most oncogenes in breast cancer are actually mutated versions of normal genes called proto-oncogenes. These normal genes help regulate cell growth, division, and survival. When they mutate or become overactive, they turn into oncogenes that push cells to grow too fast, avoid dying when they should, invade nearby tissues, and even stimulate the formation of new blood vessels to feed the tumor. This uncontrolled growth is what leads to cancer. One of the most well-known oncogenes in breast cancer is the HER2 gene. Normally, HER2 helps regulate healthy breast cell growth. But when it mutates or is amplified, it produces too much HER2 protein. This excess protein causes the cancer cells to grow aggressively. That is why HER2-positive breast cancers tend to be more aggressive and requiring specific treatment. This is where targeted therapy comes into play. Instead of using traditional chemotherapy that affects all rapidly dividing cells, targeted therapies focus on specific molecules produced by oncogenes or the pathways they activate. For example, drugs like trastuzumab are designed to block the HER2 protein. By doing so, they slow down or stop the growth of HER2-positive breast cancer cells. These therapies are more precise and often have fewer side effects than traditional treatments. Targeted therapies can also inhibit other proteins involved in cell growth, like mTOR, which is part of a signaling pathway that can be abnormally active in some breast cancers. By blocking these proteins, doctors can tailor treatments to the specific genetic makeup of a person's tumor, making therapy more effective. Understanding oncogenes is crucial because it helps scientists develop these personalized treatments. When doctors identify which oncogenes are driving a patient's cancer, they can choose therapies that specifically target those genes. This approach has transformed breast cancer treatment, especially for cancers that are driven by specific oncogenes like HER2. In summary, oncogenes are mutated genes that promote cancer cell growth and survival. Recognizing these genes allows for targeted therapies that interfere with their function, offering hope for more effective and personalized treatment options. Always remember, each person's cancer is unique, so it's important to work closely with healthcare professionals to determine the best approach for your specific situation.